So we are over a year now into this pandemic. And really, when we put this into perspective, into context, we think about those on the front line. And there's some very special individuals here. We are continuing to celebrate National Nurses Week, honoring some of our nurses who have braved those front lines and they care for those patients. Has been a year. It has been a year, and that is an understatement.
For sure. We are blessed to be joined by three frontline nurses here on National Nurses Week. Good morning to Jennifer Miller, critical care nurse, Diane Martin, CEO of We RPN, and Roxy Danielson, a street nurse. We thank all three of you for your service and thank you for joining us today. Jennifer, let's start with you. Can you put into words what these last 15 months have been like for you?
Putting that into words is really, really, really difficult. What I will say is that I'm so proud of my colleagues and the crews that I work with. The theme of Nursing Week this year is answering the call, and we have gone above and beyond that this year. Answering the call is something that nurses have always done. We've always been there, and typically and historically, we haven't said much about our plight. I can tell you that we don't have any time to grieve. After a Zoom call, when I'm sweating and I have all the PPE on me and I can feel the sweat pouring down my back, and I'm not able to connect that Zoom call, and I'm not able to make that connection when I need to, the stress and the anxiety that I feel is astronomical. I can't tell you how many times I've cried in the bathroom, and I've heard my colleagues cry in the bathroom. We can't even hug each other at this point, so we have to just nod and carry on. Something that we say often is to keep swimming. In short.
These are the stories, and unfortunately, we've been hearing so many of them, and this is why we wanted you to join us today to have our audience really understand the personal struggles that you deal with, because you are brave, you are warriors, you are so strong, and being for people in many of these final moments. So thank you to all of you. I want to make sure we say that. Diane, for you, can you elaborate a little bit more on some of the personal experiences on the front line and what you've been hearing from everyone involved? Because nurses, and I got to give you such a shout out. Again, my mom is a retired nurse, and I saw her take these stories home with her personally. You know, these are not just patients. And so where are we? Sorry, go ahead.
Well, first of all, I'm not a frontline nurse anymore. I was for 30 years. Now I work with the Practical Nurses of Ontario to try to advocate for them when they're experiencing things like this. And one of my jobs is to interact with them daily to find out what they're experiencing in every sector, whether it's a hospital or a long-term care home. And I have to say, it is, if you were to speak to a nurse who is working with a COVID patient or during COVID times, you probably won't hear from them the finer details of what's really hurting them. For example, I spoke to some long-term care nurses, and they weren't long-term care home nurses, but they went to a long-term care home to work when no staff were able to show due to illness. And those patients had been lying there. Keep in mind, they're there for full care, had been lying there in their beds or sitting in chairs for very long periods of time with food untouched because they can't feed themselves. And you have to understand that nurses are so motivated by making a difference in someone's life. And when they see suffering to that degree, they first of all won't tell you much about it, but it lives with them for the rest of their lives. It feels like failure. It feels like a challenge that is beyond them. And 83% of practical nurses have reported their mental health has been affected.
Roxy, you are a street nurse.
That's correct.
So I am assuming you have seen this human tragedy from a whole different angle. What has it looked like through your eyes?
Wow, that's such a loaded question. This year has been more difficult, like any nurse would explain, but especially for the homeless community. We've seen shelters that have just been ravaged by COVID. Like hundreds of homeless people got COVID-19, and we know from anecdotally and from studies that homeless people are more likely to get COVID-19, to become hospitalized from COVID-19, and to die from COVID-19. We've also seen an increase of overdose deaths this year. In Ontario, there's a 60% increase of overdose deaths from 2019 to 2020. And that's because of people being evicted from encampments, being shuffled around, an increase of toxic drug supply. So not only are we dealing with COVID-19, but we're also dealing with other factors that affect the homeless community as well. And so we've lost a lot of people this year, and it's been incredibly difficult and incredibly stressful on street nurses as well.
Jennifer, I want to come back to you and talk about the motivators, other than being selfless and compassionate and wanting to do the best you possibly can at your job. There's the conversation about compensation, and that nurses are not acknowledged enough, recognized enough when it comes to that. Where do you stand with it?
Well, the cat's out of the bag in the sense that typically nurses don't like to talk about money because, you know, right now in this time, we're lucky to even have jobs. But the truth of the matter is that this government has capped our wages. Bill 124 exists, and it's a bill that essentially doesn't allow us to bargain at the table. So not only have we been asked to deal with not enough PPE, not only have we been asked to deal with the increased workloads, not only have we been asked to delegate out to workers that have never worked in ICU before. We have redeployed nurses coming in who haven't been at the bedside in over 25 years, who've worked in IT, who are horrifically afraid. It's tough. It's tough to sit here and say that, you know, when someone is out of the job or the economy is what it is, that nurses deserve more. But the truth of the matter is, guys, that nurses deserve more. We are capped at 1%. We don't even have the ability to bargain at the table right now. We need everybody to help nurses. We not only need you to stay home, wear a mask, wash your hands, and get vaccinated, but we need you to please, please, please contact your local member of parliament and ask them to please repeal Bill 124 and abolish it, not only for the nurses, but for the teachers. It's unimaginable. It's unimaginable. We deserve more than 1%. We haven't had a cost of living increase in over 10 years. 10 years. Nurses deserve more. And to be honest, nurses this week are not celebrating. Nurses are not happy. We are mourning. We are mourning the loss of our patients. We are mourning our tortured families. We are mourning for our crews. We're mourning for each other. I can't tell you the amount of mornings that I have a difficult time getting out of bed because I'm not sure if I can do it again. In the last month, the 6 COVID patients that I've had have all been under the age of 65, and 4 of them have passed. That's the reality.
And that's been the reality for months, over a year.
That's the reality, yeah. And it's nothing to celebrate.
But, well, first, Jennifer, we appreciate all three of you. Again, we thank you for your service. If you want to help nurses across the country and here in Ontario, you can do 2 things based on the conversation I just heard. One, contact your political representatives. Twitter is a hell of a thing nowadays. You can reach them very quickly. Everyone sees it. Do it that way. And also, I know numbers are kind of going down, and I had a couple of texts over the weekend. Oh, look, the numbers are moving. Pay attention to the ICU numbers, folks, because if they're not moving, we really don't get the relief for our guests that we need. And they're moving a bit, which is good news, not enough. Stay away from each other, be socially distant, because it affects everyone, especially our 3 guests this morning. Again, we honor you. Thank you for joining us today.
Thank you.
Thank you.
Thank you.
Thank you.
So powerful and so interesting to hear it from firsthand. You know,
sure.
It's very difficult for someone to get in the minds of nurses and to hear the struggles. And so thank you for putting that out there and what you can do at home if you were listening to this interview here. All right, we're going to switch gears right now. It is 7:17. Steph, let me find my camera. Here we go. I'm having
different space.
Here we go.
Space.
Stephanie Henry, good morning.
Hey, good morning. I want to say thank you to the nurses as well. I mean, all they do, I couldn't even imagine doing that every single day. And it takes a special person to be a nurse, especially during this time. So thank you to our nurses and our frontline workers